Okay, good afternoon, everybody. My name is Peter Zanoni. I'm Corpus Christi City Manager, and we want to welcome you to our COVID-19 briefing today. Today it's exclusively dedicated to Texas A&M Corpus Christi, who's going to do a weekly update on their modeling and projections and recommendations on how we stay safe. The background is several months ago when we were dealing with day after day of cases of COVID-19 here locally and in the state and the country and the world. What Corpus Christi did not have is some type of a modeling projection, so we could kind of estimate where was our curve going to peak and come back down. And we didn't take us long to figure out that the best people to ask is Texas A&M Corpus Christi. They have tons of scientists and professors, and we knew that they'd be the right persons to ask. And without hesitation, after we asked Dr. Miller, the CEO and president of the university, there was no time, she immediately responded and said, well, put a team together and help you all out, or help the community out. And so that team has been working pretty feverishly for about, a couple of months at least, I think, at this point. And each week they have been presenting their updates in terms of actual cases within not just Nueces County, but other counties in our coastal bend. They've been doing a lot of modeling to show us what they think the forecast is for recovery or for more cases. And they've also been showing how preventative measures like wearing face masks, social distancing, staying at home can make a big difference in terms of spread and new cases. And so today is another update on their findings and work. And before they begin, I just want to summarize a couple of things. On Wednesday is when we're doing our weekly briefings now with the Mayor McComb, Nueces County Judge Barbara Canales, myself, and our Health Director, Annette Rodriguez. So as of this Wednesday, when we presented the information for that point in time, I just want to recap it. When we looked at the week of Wednesday, back 1 week, we had a total of 17 cases for that 7-day period. But when we look back the week prior to that, it was just 12 cases, or not 12, not just, but 12 cases. So 17 for this last week, Wednesday to the past Wednesday, and then 12 cases the prior week. So you can see a little bit of an increase. And also on our average daily number of cases, when you look at a 7-day averaging number, this week it was 2.4, and the week prior 1.7. So we have seen an increase slightly in the number of cases and the average number of cases as well. And we want to point out that there still is no cure for the virus. The virus is still alive and well, and we need to continue to be vigilant to stay away from it and protect ourselves. And so that means there's no vaccine, there's no cure, it spreads very fast, and it's very dangerous to the body. So the things that we have been talking about include wearing face masks when you're in public, or in large group settings, keeping your hands clean, keeping dirty hands off your face, not touching your eyes, your nose, your mouth, or your ears, and social distancing as much as possible. Stay 6 feet away from people. Don't shake people's hands. Yesterday I was in a couple of different settings, and the first thing people want to do is shake my hand. So we have to remember, don't shake people's hands. You maybe do the fist bump or the elbow bump, but the less we kind of touch each other, the better for right now until there's a vaccine, basically, with the virus. So we'll be back here next Wednesday, myself and that other group of elected officials I talked about, and Annette Rodriguez as well. And so with that, we're going to turn it over to Dr. Bird. One thing we started last week is those folks, and we appreciate you, that are watching this on Facebook Live. As you type in your questions, we have staff from the university that's summarizing the questions. And then at the end of Dr. Bird's presentation, we'll go over those questions one by one, or kind of grouping them. We'll have a gentleman, one of the professors from the university, will ask the questions from the microphone so everybody can hear them, and then Dr. Bird will answer those questions. So continue to chat and send in your texts on Facebook Live. That's a good part of this forum. And we also know people are watching on our YouTube station or channel, and we do have Chris Six here covering it as well for us, and so we appreciate them being here. And with that, let me turn it over to Dr. Bird. Thank you.
Good afternoon, everybody. How's the sound? Okay? Right, this is the end of the second month of our presentations, and this is the end of our first month of Open Texas. So we had a month of stay at home, and then we've just had a month of Open Texas. We're going to see how we're doing in that context. Here on behalf of the Corpus Christi, Texas A&M University Corpus Christi COVID-19 Modeling Task Force, our website can be found at tinyurl.com/TAMUCC-COVID, COVID. You can go there, check out our dashboard for the local area, and we have some other reports and figures in there for you to see. I want to remind you each week about the objectives of the task force. Objective number 1 is to address public concerns and questions about COVID-19 and the interventions that are being taken to control the transmission of COVID-19 in the Coastal Bend area. And once again, we're going to field questions from the audience on Facebook Live, so type in your questions and we'll hopefully answer them for you. The other thing we're doing is trying to enable evidence-based decision-making. So our leaders aren't just making gut-based decisions, but they have all the latest information on which to make informed decisions about how to adjust our policies to keep us all safe and healthy. Each week, the presentation is divided into 3 sections. The first section is on the case data. So this is where we'll go over the number of cases that we've seen in the Coastal Bend area. This report is for the whole 12-county Coastal Bend area. In situations where we're talking about a larger or a smaller region, I'll make sure to point that out. What you see here are 2 heat maps. One is the total number of confirmed COVID-19 cases that we've had in each county in the Coastal Bend area. You can see that the brighter the color, the more cases that we've had. So Nueces County is the epicenter, and then San Patricio County secondarily has the second most cases. In the purple, you can see the active cases. It works the same way. The darker, brighter the color, the more active cases there are. And again, Nueces and San Patricio County are the primary places, and really it's Nueces where the confirmed cases are centered. This next slide is showing us the number of tests that have been performed per day over the past couple months. Right now, the last report we got was there were 137 tests that I have in the data set here. You'll notice it's coming down, but the reason why that's happening is because a few weeks ago we had these outbreaks occurring, and what happened was we were testing every single person that worked at a company with 800 people, every single person that was associated with these 2 transitional housing facilities. We were testing nursing homes, and so this turned into a lot of tests. The reason why we're declining in the number of tests now is that there's fewer people that are requesting tests or that are getting recommended to have tests by their doctors because there aren't as many outbreaks occurring now as there were a few weeks ago. So it's not because of a lack of testing that we're down from what we were a few weeks ago, and if anything, you can look at it as maybe a good sign as opposed to a bad sign. The percent positive tests per day is back up to where we were before Open Texas started. So we were talking about now we've had a month of Open Texas. How have we fared? Well, a month ago, I didn't think we were going to fare well, but we've fared very well so far. We did have this one outbreak incident, which shows you that we need to remain vigilant. This could happen again. The reason why these outbreaks would occur is that there's an environment within the Coastal Bend area where the transmission rate, which is the probability of you transmitting the virus if you have COVID-19 to more people, it was higher within some buildings or in some facilities than in other locations, which led to those outbreaks. They've been contained, policies have been changed, and they're no longer showing up in our data set. And we're back to where we were pretty much in the past week. The percent positive tests is where we were just before, or right in the first week of Open Texas. In terms of the total number of cases that we've seen in the Coastal Bend area, right now we're at 384 cases total with 281 recoveries. What I want you to focus on is the slope of this line. That's what matters. So this steep slope, that's from the outbreaks in the past. It's a rapid rise in the number of cases. We've been kind of on a more level or a less steep rise, and there's a little uptick in the last couple days of data that we have. I'm calling this the Memorial Day bump because we're right in the right time frame from Memorial Day to now for cases to be showing up as positive and those results coming back. Our active cases are headed downwards, and you'll notice there's a slight difference between the numbers here and on the heat map previously. The heat map's a little bit newer than the data here. This is yesterday's data that's in this graph. For Nueces County, we're at 286 total cases, 108 active cases. You can see right there, there's a disconnect because this is newer data, and 175 recoveries, and 3 fatalities. The number of fatalities hasn't increased for several weeks now in both Nueces and the Coastal Bend area, and we hope that that's going to continue. Each week we compare the Coastal Bend to Bexar County, which is the most populous county in San Antonio. And we do that because of our close connection with San Antonio, and we like to go shopping there, and they like to come to our beaches. So this is the number of cases per capita. So we have a total number per 100,000 people. There's about 600,000 people in the Coastal Bend area, and I'll give you a little bit of a calibration. You can see the outbreaks right here. We have that steep uptick, but when you compare us to Bexar County, we have far fewer cases per capita, 2.3 times fewer than in Bexar County overall. Okay, in this graph, it's a little bit different. This is the number of new cases per day. Each point on this graph represents the actual number of reported new cases per day, where circles are from San Antonio, Bexar County, and the triangles are from the Coastal Bend. The data is kind of noisy, so we fit these smoother lines through it that show you more of what the trend is. And you can see every once in a while there's a really high point. So for example, recently there was a very high number of new cases in Bexar County. What we think for that uptick there is sometimes positive tests maybe get lost in the mix, and then they show up all in one day when they should have been reported over several days in the past. We think that's what happened there, although we don't know for sure. I'm talking about that now because we have talked about that on the task force, and it might happen to us at some point. So this is a little bit of a foreshadowing that if this type of thing ever happens to us, it's not necessarily because there are all these new cases on one particular day. What you should pay attention to is that both Bexar County and the Coastal Bend are going up from last week. And again, I'm calling this the Memorial Day bump because it's almost exactly the right amount of time from Memorial Day to now to have positive tests coming back if you got infected over Memorial Day weekend. And you can see there's even a steeper uptick in the Coastal Bend. There's probably more people coming to the Coastal Bend area, coming to our beaches for Memorial Day. I think everybody remembers the line of traffic going from Padre Island pretty much all the way to Ennis-Jocelyn on the SPID. When we look closer within our Coastal Bend area, here in the orange we have Nueces County, and the teal triangles are the rest of the Coastal Bend, the other 11 counties in the Coastal Bend. And again, you can see this Memorial Day bump that's occurring right now this week. Hopefully that's all it is, and it's not the start of something more, but right now the timing and everything is lining up right for Memorial Day explanation of these new cases that we're seeing. And in the rest of the Coastal Bend, the uptick is so small that you can't quite see it relative to the uptick that we see in Nueces. Overall, these numbers are very low. This is the number of new cases per day, and we're somewhere around 4 or 5 if you follow that curve. In the past few days, we've seen some numbers like that for Nueces County. Okay, so that wraps up our review of the case data. Now we're going to go to the cell phone data, and I spent a little time this week along with Lucy Wong, Dr. Lucy Wong from the university, who's been working the cell phone data and giving us new metrics. And I show this image because it's from The Dark Knight, where Batman, it's very controversial that Batman uses all of our cell phones to be able to save the day, and it was a huge moral conundrum in the movie back in 2008. But today, it's not that much of a moral conundrum, it seems, because almost all of us are being tracked with our cell phones. So you might be wondering, I know last week a couple people were saying, well, how do we have access to that data? Well, when you go to your phone and let's see, do you have Google Maps or do you have some sort of Waze or Apple Maps on your phone? If you do, it asks you, can it use your GPS? If you click yes and your GPS is on, then you're getting tracked. That data is used for not just making Mark Zuckerberg rich, but also for selling to other businesses, and those businesses use that information to target you with ads. They also use it to make business decisions, such as where should we build our new store. So we have access to this data. It's anonymized, it's processed to some level. We don't have access to the raw data. We can't look up your names in the data or anything like that. But what we can do is use it for good, sort of like Batman was doing in the movie, and not trying to sell you anything with it. So this might be one of the only times in your lifetime where we're using this data to do something besides selling you something. So I think it's important to review the interventions at this point that are in place, because the whole point of the cell phone data is to evaluate the effectiveness of the interventions and get kind of a head start on what might happen in the future. Because cell phone data can give us ideas about how much infections might be happening at a particular time. Then from the point you get infected to the point you're symptomatic, that's an average of 5.1 days. Might be a few days before you see a doctor and get tested, and a few more days before you see those results come back. By that time, you're at about 2 weeks after you got infected. So one of the interventions that's in place is you're requested to stay at home if you can. The official stay-at-home order is over, but you're requested to stay at home if you can. There's a loosening of restrictions on social and public gatherings, and this occurs in a variety of ways, from restaurants to movie theaters. Schools are closed. We're being encouraged to social distance, not just stay 6 feet apart, but also wear a mask. What I like to say here is I have a Doberman for a dog, and my leash is 6 feet long. You don't want to get within 6 feet of me, even though the leash is exactly 6 feet long. You want to stay farther than 6 feet away when I'm walking my Doberman. And so that's how you should treat social distancing. 6 feet is the minimum, and there's some scientific publications that came out recently and showed that even if you stay 3 feet away, it's pretty effective at stopping the transmission of COVID-19. If you stay 6 feet away, it's more effective. I mean, why not go all the way to be completely unlikely to contract COVID-19 at all and stay even a little bit farther away? And lastly, self-isolate when symptomatic. If you feel sick, if you have that tickle at the back of your throat, self-isolate means don't go into work, don't go to the grocery store, don't go shopping, go home, call your doctor, and take it from there. So let's see how these interventions are working. The first are school closures. Last week I showed just one line for school closures. This week I'm going to show you all three. We have the blue K through 12, the green universities, and the red junior colleges. You can see that the school closures are pretty effective at reducing the amount of foot traffic at the schools and universities in the area. Now the way this works is 100 means normal. What we did was we looked at the amount of foot traffic to these types of institutions in February and March. We took the average of that and we made everything at that average be 100. So if you go all the way down to 0, that means actually 0% activity. And if we get all the way back up to 100, that means we're back to the normal amount of activity or foot traffic that was occurring between February and March. In this case, the way this works is your cell phone might be on with the GPS and it has you at the location of the school. And some of the data that I'm getting back, it even looks like it can tell whether you're in the drive-through at a restaurant versus inside of it. For example, Chick-fil-A, I'm noticing, has not come up with the other restaurants as much. I'm not showing that, but I've noticed the drive-through at Chick-fil-A is packed. And so I'm thinking that it's good enough to tell the difference between that. So that's how it works. Normal, stay-at-home starts, kind of flat line out. It's not all the way to 0 because we still need essential staff at the schools and universities to keep them going. Okay, some people are staying at home. We can infer this from the cell phone data. We have two different lines that we're looking at here. One is the percentage of people leaving home. And this is compared to normal again. 100 means normal, not 100% of all the people. We go down in the stay at home to about 80. We're back up to about 50% of normal for the amount of people that are staying home, or in this case, staying home or leaving home on any given day. The other metric we have here in red is distance traveled. This peak here is spring break. The peak over there is Memorial Day. So that can kind of calibrate you. Now, distance traveled might increase if you're going to work or if on the weekends you're taking trips to see relatives or things like that. And what you can see is that the distance traveled is almost back up to the normal range versus where we were. So these are two different ways to look at how the stay-at-home is operating. And it seems that we're still at a lower level of probability of transmitting COVID-19 than we were before we realized the pandemic was occurring. There's more encounters on weekends. This particular cell phone index keeps track of how proximate each phone is to each other phone. When two phones come within 50 feet or 50 meters for less than 60 minutes, the probability of them coming within 6 feet is calculated. Now, your GPSs on your phones aren't, they're not precise enough to be able to tell the difference between 6 feet apart or 20 feet apart. So it's a metric that we can use to tell how close are people getting. What it can't know is, are you wearing a mask? Are you wearing an N95 mask? Are you staying more than 6 feet away? So even if this metric comes back up, if we're doing our social distancing properly, if we get back to normal, it doesn't mean the same thing as it did back here where we were being told not to wear masks, right? So again here, when you compare black Monday through Thursday to blue Friday through Sunday, and the reason why I'm grouping Friday with Sunday and Saturday is because the activity amount in the Friday is similar to Saturday and Sunday. People are probably leaving for the weekend. You can see that before the stay at home, that the weekends had more encounters than the weekdays, and then they kind of got even, and now since Open Texas, that gap has opened up again, and we're back to a situation that's not quite exactly what we had in February and March, but it's getting close to the same amount of encounters that we had in February and March on weekdays, on weekends. On Memorial Day weekend, we were kind of right back up to that normal level. Yeah, and there's Memorial Day right there. We can also infer, okay, there was a lot of people here. They're coming to our beaches. I noticed that the hotels are getting more full. You can see that on the red graph here. And we expect that this number is going to go much higher than 100 because between February and March, not as many people are coming to the coastal bend for vacation as are going to come in the summertime where we're entering into. So the hotels have crossed that normal threshold and we expect that they're going to keep going higher. Where did these people come from? Well, we can look at the airport and the foot traffic at the airport to compare. And what we can see is that the airport dropped off and we're nowhere near coming back up to 100% of the activity that we normally see at the airport in February and March, let alone in the summertime. And so that indicates to us that most of the people that are coming into the Coastal Bend area, they're coming by car. We don't know how far away they're coming from. We don't have, we'd have to pay a lot of money to be able to determine things like that to get better data than they give out for free. But that lets you know that people aren't really flying in yet. And we can keep track of this through time and see how that changes. Excuse me. And once again, spring break right here, this peak. Usually when you see a peak early on the graph, that's spring break. If you see a peak farther on the graph, that's Memorial Day. Okay, another interesting thing we can do is look at medical and foot traffic. Last week I was talking to some doctors and they were concerned that some of their patients weren't coming in to be seen even though they needed to be seen. I think we've all seen the news reports where there's a remarkable decline in the number of strokes and heart attacks that are being reported because people aren't going to get the medical attention that they need. So here what we've done to try to get a window into this dynamic is we compared the amount of foot traffic at hospitals, doctors' offices, and the labs that get jobs from doctors' offices, say to process your blood, and eye and dental offices. Now with eye and dental offices, I don't think that too many people are thinking COVID-19 as much when they go there versus, I mean, we're all thinking COVID-19 with the doctor's office and the hospital, right? And so what you can see is that there's been a huge increase in the eye and dental activity from the trough in the middle of the stay-at-home to now relative to people getting treatment for their medical conditions. And here's what some of the doctors I know were telling me. They were saying basically the medical outcomes are going to be worse if you don't get treated for whatever conditions you have right now that aren't good. You don't feel well. That outside of COVID-19, you have a pain in your chest. You need to get treated for that because you're more likely to have a negative outcome if you don't get treated, than if you do get treated for it. COVID-19 concerns aren't so great that you should avoid going to the hospital when you have pains in your chest or when you think you might be having a stroke, or even for less severe and serious physical ailments. So this is something that we're looking at. Now, something else that could explain some of this discrepancy is telehealth, which I know some other people that I know are doing telehealth, and that's making up for some of it. But even those with telehealth have some concerns that maybe their patients aren't having the same medical outcomes as they would be with in-person visits. So that's something for y'all to think about. And really, when I saw this and I talked to those doctors, I thought that perhaps I should go get my physical pretty soon, and I'll keep you all updated when I do that, just to promote that we should be going out and getting treated for our physical ailments. The last one I'm going to show you, and I built up complexity here. So before you get overwhelmed, there's the blue and there's kind of the yellow colors, the yellow-brown colors. Okay, so the blue are essential gatherings, and these are businesses. So we have home improvement stores at the top, and we have grocery stores also here at the top. And what you can see is that it looks like a whole lot of people, when they're staying at home, are working on their house, as opposed to going out and going to the beach or doing other things. I don't think that this increase in the foot traffic at the home improvement stores now is due to preparing for COVID-19 or even the tropical depression that's out in the Gulf. It looks like we're working on our houses a lot more, so hopefully that's going to bring up all of our property values. And for the what I'm calling non-essential businesses, like or places you go to gather, like movie theaters, are pretty low. That looks like school closings almost. Bars were pretty low, and then we know that bars opened recently, and now you can see a dramatic upswing in the foot traffic at bars. Restaurants have been steadily increasing in foot traffic since the middle of the stay-at-home, and malls have just eclipsed grocery stores. And I thought about this for a moment, and some other people suggested, well, maybe that's curbside that's causing that. It's kind of hard to get curbside from a store in the middle of the mall, but it's easy to get curbside from H-E-B or Walmart or one of our grocery stores in the local area. So that gives you an idea of how we're behaving in terms of where we're going, how much we're getting into situations where we might transmit the virus, where we don't have to, like at bars. You don't have to go to a bar. But if it wasn't the middle of a pandemic, I would probably be going to the bar too. So the third part of our presentation is on model estimates and predictions. And I'm going to start this off with last week, and probably in the past you've heard me say something about the difference between an epidemic or an epidemiological model and a statistical fit. And so I'm going to explain right here. Everything that I've shown before this point is just a statistical fit to the data. Everything I'm going to show after this point is the result of an epidemiological model. The model is aware of the dynamics of the way that a pandemic works, and we've parameterized it. So it's essentially simulating the pandemic, either in Nueces County or in Texas or in Public Health Region 11, which is the southern tip of Texas where we reside. People are susceptible to COVID-19. Pretty much all of the people that haven't gotten it are susceptible. When you get infected, you eventually become infectious, and you could, depending on how the interventions affect you, you could transmit it to other susceptible people and then kind of feed into this infectious pool. Now in the infectious pool, you can have two paths. One path is you go directly to recovered. The other path is you go into the hospital system if you have more severe reaction to COVID-19. From that point, you can either go to the recovered or you can go down into the ICU. Most people are coming out of the ICU and end up back in the recovered category, but in the Coastal Bend area, we've had 4 people go all the way to the bottom of this and end up with the fatal outcome. Now, the difference here between all the models, all the graphs and whatnot that I've shown before, and this one is that here, the points are the actual data points, but that ribbon that you see, the blue and the gray, that's a model. It's not just a statistical fit to those points. It's that line, that ribbon, is generated by a process based upon this mechanism here. And so it's not a foregone outcome that's just going to fit. In this case, what I'm showing is our Texas fatality forecast. We have this for different areas of Texas. It's parameterized on the number of fatalities. You have to have at least 10 fatalities in an area for it to work in the first place. So we run it on the public health regions across Texas. And what you can see here overall across all of Texas is it's projected that the number of fatalities per day are going to increase moving into the future. This is an epidemiological model, not just a statistical fit like everything you've seen previously. Everything after this, epidemiological model. So the transmission rate is this thing that we're really concerned about because that's how many people get infected after each other person gets infected. So for example, if you start with one person infected at a transmission rate of 2.7, that would mean that 3 additional people get infected from 1, and then from 3, after 2 weeks, 7 additional people get infected. Those 7 people infect another 20 people on week 3, and then those 20 people infect another 53 people on week 4. So this is exponential growth, and that results in 84 people infected in just 1 month from one initial infection. This is what would occur if there were no interventions in place and if we weren't doing anything to mitigate the transmission of COVID-19. This number is being estimated by the same model that I showed you a fatality forecast from in the last figure. Now, this is our estimate of what the actual transmission rate is with the interventions that are in place. It's 0.9, so 1 is the magic number. 1 makes it so that you don't have an increase or a decrease in the total number of people at any one time having COVID-19. At 0.9, it's a very, very slow decrease. What it looks like is one person infects one other person, infects one other person, etc. But it's 0.9, so it's not exactly a 1-for-1. Before about a month and a half ago or a month ago, we had, no, it was a month and a half ago, this number was 0.5, and I said it was like a coin flip. You flip a coin to decide if it gets transmitted from one person to the next. In this case, you can roll 2 dice. If you get anything other than a 2, a 3, or a 12, then you're going to transmit the virus to the next person. So that's the way that we would probabilistically parameterize this model. Luckily, we have computers to do this, and we don't have to sit there rolling dice to simulate. The result is instead of 84, you have 5 people infected in 1 month with the current transmission rate that we're estimating. So this is relatively good. I showed an earlier version of this heat map last week. This week, every number on this map is lower than it was last week. So across all of Texas, our estimation of the transmission rate has declined, and every public health region, which is each area here on the map, has declined. If you don't like numbers, just look at the colors. Red means increasing, blue means decreasing. The brighter red, the more it's increasing. The brighter blue, the more it's decreasing. And white means you're right at 1. You're not increasing or decreasing. There's a clear pattern here where the farther south you go, the lower the transmission rate is. And we've started to look at different things that predict this. And what we're starting to find is that almost everything that we look at captures some aspect of this pattern. We're looking at precipitation, we're looking at humidity, we're looking at temperature. We're also looking at things like where are there highways, how close are those highways in proximity to population centers. The cell phone data for the proportion of people leaving home, there's the least people staying home in this part of Texas, according to the cell phone data, where we also see the highest transmission rate. So there's a lot of different things right now that we see correlating with this pattern, and we're working on a more rigorous statistical treatment to isolate and identify what's causing this interesting pattern. But overall, it's going down. Across all of Texas, the transmission rate, our estimation of it, is declining. This is an outcome for the hospitalizations projected from a different model that we're running. So we have two epidemiological models that you'll see different aspects of. So for this model, it's more parameterized off of the case data, and we use the initial model that we were talking about before with the transmission rates to parameterize this model also. So this is not a statistical fit to the data points. We don't even look at hospitalizations when we parameterize this model and we run it. And based upon the average rate of hospitalizations by age class across the rest of the world, amazingly, we're able to get a really great fit between the red, which are the actual number of people that are hospitalized on any one day for COVID-19 in the Coastal Bend. And these aren't new hospitalizations, it's census, how many people were in the hospital on that day for COVID-19. They may have gone home that same day, or they may have stayed overnight, but they were definitely admitted. And so the blue line is our best estimate of what the model predicts, and the points are pretty well focused on the line. And the really important part is now, out here. I'm not paying as much attention back here early in the model to dial it in perfectly, as what's important is that out here that we're matching up with the data very well, and we have some sort of confidence in what is going to happen in the future. This is the most confident I've been in any one of these presentations that I've given that this should be what it looks like by next week. Right here you see the spike. This is from the outbreaks. Now you're going to see deviations from that average line. We're seeing right now an increase in the number of cases. And I want you to remember that increase in the number of cases is for Nueces County. It's for the Coastal Bend. It's not for all of Public Health Region 11, where we're estimating the transmission rate from. But these are the number of people in hospitals in the Coastal Bend and in Nueces County. These are the number of people in the ICU. Again, same thing. We have pretty good fit between the model and the data points, and we feel fairly confident that we're well within hospital limits, and we don't foresee any huge increases in these numbers in the next couple weeks, barring some sort of another outbreak situation. And even then, we'll stay well within the capacity of the hospitals. So to wrap it up, the number of new cases in the Coastal Bend are increasing, and it looks like this can be tied to Memorial Day. So we're seeing what looks like a Memorial Day bump. Next week we'll know for sure, because if it was a Memorial Day bump, we'll see it come back down. If it was something else, maybe it'll keep going up, or there could be a kind of a butterfly effect from that initial Memorial Day bump. Second, non-essential activity is increasing. This is what the cell phone data shows us. But even though that non-essential activity is increasing, which you would think would lead to increased transmission rates, it's not. COVID-19 does not seem to be expanding in South Texas, and our estimates of the transmission rate across all of Texas are down this week over last week. So this is good news, but it's not time to be complacent. When we see some things are going up and other models are going down, this is where we want to pay close attention and see what happens next. There's a geographic pattern in the transmission rate across Texas. It looks very intriguing. Hopefully next week we'll have more specific results to show you on that. We're definitely looking into it. And the hospitals are well within capacity, and everybody should rest assured that we're in close contact with the hospitals. They let us know if they notice an increase in the number of patients that's outside of expectation. We let them know if we see something that's outside of expectation. Each week I talk about the importance of containing these local outbreaks. We've demonstrated the ability to do this once. It works. Testing and contact tracing works. Compliance with the local authorities works. If you're a business or a business leader or a frontline worker or an essential worker, that was involved in one of these. Everybody should be commended for complying to make this a success story, and not just that it was contained, but that it seems that policies were changed to control the spread of COVID-19 in those places where it was occurring. And the lesson here is that if you don't close the loopholes in your social distance policy, if you're a manager, COVID-19 is going to find those loopholes for you and point them out. And you'd prefer to close them before COVID-19 finds them. For the rest of us that aren't managers, we can all make a difference here. Now, right now, our transmission rate is right on the precipice or the cusp of increasing or decreasing. We're at 0.9. That could easily change to going above 1. The way that we stop it from going above 1, we continue wearing face masks. We continue to stay 6 feet away from other people. We self-isolate when we're symptomatic. Stay home if you can. Postpone social gatherings if you can. Do curbside and takeout if you can. All these things will help to decrease the transmission rate and keep it below 1 in the coastal Bend area and South Texas, and most importantly, support testing and contact tracing so that outbreaks can be contained and they become just flare-ups instead of something that caused a chain reaction down the line. So with that, I'd like to thank everybody that contributes on the task force. It's a really large group. There's professors, there's people from the city, people from the county, public health director, a lot of doctors are giving us feedback, and several graduate students and undergraduates at TAMU CC are contributing each week to this, and they all deserve a lot of credit. So with that, I'll let the translation go, and then we can take questions.
En resumen, primero le queremos recordar que los datos presentados en este estudio cubren la región del área de la costa, la cual consta de 12 condados y no solamente las cifras del condado de Nueces. El porcentaje de casos positivos por día se ha mantenido en el 2.3%, mismo porcentaje que se registró antes de que reabriera el impulso a la economía. En el área de la costa se ha reportado un total de 384 casos positivos, con 281 recuperaciones, hay 99 casos activos y 4 decesos por el virus. Durante el fin de semana feriado por el Día de los Caídos, se registró un aumento en las cifras de casos positivos. De acuerdo a la información arrojada mediante los estudios por la ubicación de teléfonos celulares, indican que las órdenes dictadas en el área han dado resultados positivos. Esas órdenes incluyen la orden de mantenerse en casa, el no estar en grupos grandes de personas, el cierre de las escuelas, el distanciamiento social y el autoaislamiento cuando existen síntomas. Los hoteles han registrado un mayor número de visitantes. La mayoría de ellos viajan mediante vehículos y se estima que esas cifras van en aumento. Las visitas a los oculistas y a los dentistas han aumentado, pero las visitas a los hospitales han disminuido. Es importante recalcar que si usted no está bien de salud, consulte a su médico o acuda al hospital. En cuanto a las predicciones, si no existiera ninguna sugerencia para evitar la propagación del virus, una persona infectada pudiera infectar hasta 84 más en tan solo un mes. Con las sugerencias para evitar la propagación, actualmente una persona infectada está contagiando a 5 personas en el periodo de un mes. Las cifras de transmisión a nivel estatal han disminuido. Los hospitales cuentan con la capacidad suficiente para atender hasta 350 personas sin interrupciones y hasta 30 pacientes en las unidades de cuidados intensivos. Este grupo de investigación continúa su comunicación con el Departamento de Salud para determinar y mejorar estos estudios de predicción.
We have a few questions, and I have to apologize from last week. I understand that my mask was muting some of the sound coming out, and if you'll repeat the question, we appreciate it. Some of the questions coming from Facebook are NASCC or CCAD reporting COVID-19 incidents or cases to Nueces County, and are they included in the counts?
I would assume that they are, but I don't know specifically the answer to that. Yeah, okay, so these are questions from Facebook Live. The question is, are the cases from the Naval Air Station and other military facilities being reported locally?
Unless the think the answer is yes, because all cases within a jurisdiction accounted for that. Goes to if somebody had a residence here, but they were in school in another state, if they have it, they're gonna be counted here with their residence.
Okay, so the answer that we can agree upon in the room is yes, they'll be counted locally, but we'll follow up on that one with Public Health Director Annette Rodriguez. Thank you.
The second question is, the reported cases from local nursing homes were confusing. Are they included in the city count?
The question is, are the nursing home cases being reported in the city count? And the answer is yes. If that nursing home is in Nueces County, then that's the residents of the people that are, at least the people that are living within the nursing home, and any positive cases would get reported as usual with the other cases. As far as I'm aware, all of the cases from the nursing homes were from people that were asymptomatic. And anybody can correct me if that's not right, but I believe I heard Annette say that, 11 that were asymptomatic. And if a worker tested positive and they didn't live in Nueces County, then they wouldn't show up on the Nueces count. They would show up in the county where they live.
Is there a way to get unduplicated numbers of people tested? And what is the actual percent of the community that has been tested?
The question is there a way to get unduplicated numbers of the number of the people that are tested, such that essentially some people get tested multiple times, and are the numbers that we're getting, do they have that filtered out? And because I don't interact with the data at that level, I can't say for sure. I know in discussions in the past, I believe I've heard that there's an attempt to only have the number of tests that are being done reported once per patient, but there's so many different institutions doing tests that it becomes extremely difficult to know if that's happening across all institutions or not.
The percentage of...
So there's 11,246.
Hmm?
3.1.
So it's about 3.1% of all the tests are positive right now, and that's...
No, that's the number of tests.
Oh. we should mic you up for this, because that was a pretty specific number.
Question, the number of tests?
No, it was percent of the community that has been tested.
Oh, percent of community that's been tested. Around 3% is what our best estimate is right now. These are great questions for Annette Rodriguez.
Get her in there. All right, so here's the next question. Feel free to answer this however you want to. Is it likely there is a seasonal component to the transmission rate of the virus?
Right now, we can't say that. Here's what I would say is that people are getting COVID-19 in tropical places all over the world. Now, that being said, we're keenly interested in what we're seeing in that pattern in Texas is a seasonal pattern or something else. And so the way that we're going to answer that question is we're going to try to explain the pattern with everything that we can think of that would explain that pattern, such as population size. The more people you have, the more dense the population is, maybe the higher the transmission rate. Such as amount of traffic coming in and out with the highway systems, such as the proportion of people that are leaving their houses each day that we can get with the cell phone data. And there's a variety of different things that we can look at to try to explain that pattern. And all the things I've said so far do seem to have some relationship with that pattern that we see. Nonetheless, the reason why we think this might be a good case to really determine is there a seasonal effect or not is that Texas is really big. Everybody knows this. It extends across a large amount of latitude, unlike most states. And we go from really hot. The only two states that go farther south than Texas are Florida, where their numbers are questionable from what I've read in the news, and Hawaii, which is on an island in the middle of the Pacific and doesn't really shed too much light on the mainland United States. This might be a really nice situation where there's one state that's being managed reasonably similarly across the whole area, across a big enough of a geographic range with a huge amount of variation in climate zones that maybe we could see if there's some effect. Now, do I think that if there is a seasonal effect, it means that we're all good? It doesn't look like it, because we're right on that razor's edge of one right now, and look at everything that we're doing to try. Almost none of those cell phone graphics were back at normal levels, and so if we let up in other areas, we can go back above one, and COVID-19 is spreading in other areas. And last thing I'll say on this is that there is no answer for why there's a seasonal effect in any virus that we know of. Nobody knows 100% why there's a seasonal effect in the flu in the first place. And so we're only going to be able to draw associations between different factors and the pattern that we're seeing, and we'll be able to assign a certain proportion, if any, to the explanation of the pattern to climate-driven factors and weather-driven factors. But as of right now, we can't, with any confidence, say that there's a seasonal effect. Okay. All right, thank you.
Okay, great. Thank you, Dr. Bird, and other folks that are here today from Texas A&M University, Corpus Christi. That concludes our briefing today, and a great presentation, Dr. Bird, as usual, and good feedback from the community. This group will be back next Friday at 3 o'clock, and myself, Mayor Joe McComb, Judge Barbara Canales, and our Health Director, Annette Rodriguez, will be here Wednesday at 5. So Wednesday at 5 is the next event, and then Friday at 3 is another briefing from the university. We'll see you all then. Have a safe weekend.